Our immediate attention today is on the Syrian refugee crisis in Europe, and it ought to be. But let's pause for a moment and look at some of the longer-term consequences. Half of the population that lived in Syria before the conflict 4 years ago is now living outside of their country of origin, and half of that number are children. Inside Syria, 6 million children today are being exposed on an ongoing basis to extreme brutalities, forced family separations, forced child recruitment into fighting forces, and girls are being pulled into arranged marriages and being raped. Only 1 out of 4 Syrian children anywhere in the world today are receiving an education. 4 years ago, before the conflict, it was 90%. So the question really is, the large geopolitical crisis is looming, and the question is, what is going to happen with a generation of children who are uneducated, exposed to extreme brutalities and extreme ideologies? It's a major international relations and security challenge. If we look at Jordan, for example, the king and queen have been quite popular amongst the people, but increasingly they're facing political criticisms and whatnot. I know the United States has offered quite a bit of assistance, but it's very, very difficult to absorb 650,000 people into your healthcare systems and into your, the children into the education system, which is why only 1 out of 4 children are actually in schools. It's not something that's going to be solved in the moment. It's a long-term challenge. Maintaining political stability is part of the challenge. Increasing healthcare, access to healthcare, is going to take years. I think what we've learned from the past is the best way to do that is to let the refugees come into the regular healthcare system, don't set up parallel systems, and over time develop the capacity to deal with the increased numbers. Colleagues here at Mailman are engaging in particular in Jordan and Turkey, looking at how we can bring public health approaches to the refugee crisis. And in particular, the medical and health systems there are fairly clinically based. And so I think our challenge really will be looking at how we can work with health professionals in each of these countries to scale up prevention and mediation problems at the community and household levels.